The critics of the place make the crowd appear much larger than it is. But also I noticed Abby said that it looks like the lectern has been lowered by the staff. I think she was right. I can't even see my notes from here. But thank you for the invitation to speak today on physical activity and the workplace setting. My approach is to sort of focus in on the fact that many of these programs do very good work and are effective, but it is very much dependent on the design. There is a lot of controversy right now in the I would say the blogosphere, if you will, regarding these type of programs. Do they work? How well do they work? But it really is very much dependent on how they are designed. So that's going to be the central focus of this talk. And to do so, want to sort of follow the outline that Russ and the planning committee have proposed. Talk a little bit about the fact that the workplace is changing. It's a very dynamic setting and certainly complex. But there is at the same time within the workplace setting a huge need for physical activity and movement, knowing that there is a shift towards more sedentary job types. Then to facilitate effective programs to be implemented, I think there's a real need for an organizing framework that can be used. So we'll talk a little bit about that and then sort of dive into, so what do we know about these design characteristics that actually are related to programs, successful programs with strong outcomes. Of course, not providing an example of how that all comes together would be an oversight, so we'll finish up with a brief case study. So for starters, the workplace is very much a changing organizational, is a changing place. Technology, as we've heard this morning, very much changing the energy requirement of the job is related to technology changes. Sedentary job types create positive energy balance, and that is pervasive throughout the contemporary workplace. And then on top of that, technology actually changes the physical place from where people can work. Particularly with remote access, the workplace may not even be at the place where everybody else gathers. It may be on the road, it may be at home, it may be in literally physically different spaces. On top of that, the workforce is aging, creating multi-generational workforces. People are working longer prior to retirement because of financial challenges. And then the media and communications technologies vary widely in terms of reaching different types of workers and families to promote physical activity. So you put all that together in addition to other factors that are facilitating this, and it's pretty clear that the workplace as a setting is a complex social environment. As an example, this is data from Tim Church and his group, showing that over the past 50 years there has been a dramatic shift in the way that jobs are, that the job availability is associated with the energy requirement of such jobs. So you clearly see that there is almost a halving, 50 to 25% or so, 20% of moderate energy expenditure jobs in the United States, while at the same time sedentary jobs are increasing and light energy expenditure jobs, energy requirements for the job are increasing. So this subtle shift over 5 decades accounts for roughly 100 calories per day in terms of reduced energy expenditure for workers. Over the course of those 5 decades, that doesn't sound like much on a daily basis, but it accounts for almost 80% of the increase in weight of the workforce over those years. So to look at what do we know about weight and obesity in the workforce, this is a paper just out in the Annual Review of Public Health, looking at the fitness of the workforce in the United States. And we noticed that over the past 30 years, based on nationally representative data that is available in the literature, we see basically a doubling of obesity prevalence over the last 3 decades. Kind of confirming what Tim Church was showing in his previous slide, that certainly there is something going on with the changing nature of the job itself. engineering physical activity out of the environment. So why would employers or the corporate setting be interested in physical activity and in basically integrating movement into the day? Well, for one, it is associated with healthcare costs. So we know that based on data now published some time ago, but looking at physical activity on a daily basis, it's associated with almost 5% lower healthcare cost per active day per week. So one way to quantify this for an employer is to actually look at days per week as a metric and tie that to lower healthcare cost. At the same time, there is this challenge that physical inactivity or physical activity by itself, it's associated with many other changes and of course very closely with weight and obesity. So this interactive effect and its impact on additional healthcare costs because of associated illnesses like diabetes or heart disease, cancers. When you look at physical inactivity plus overweight and obesity combined, and then tie that to healthcare costs, roughly 23% of health plan charges are associated with those three factors combined, in combination. And 27% of the national healthcare charges are associated with those three factors, based on his data. So that starts to sort of make an argument that just from the associations with healthcare costs alone, this would be a good idea. But again, healthcare is a changing landscape as well. And so many, particularly because of the exchange and the introduction of the exchanges and ACOs, companies are now starting to look at perhaps outsourcing the benefits model. If that were to really take off, then the healthcare charges argument for a workplace may actually be limited. So you need to go beyond that and also start looking at productivity or workplace performance issues as well. Cost effectiveness still is a very real concept in business, return on investment, what do you get back for the dollar you invest. And based on the systematic reviews that are available, at least at the level of populations, we know that physical activity interventions are efficient actually in terms of getting a return, particularly when it comes to these community programs, the rail to trail programs, very low investment for the effort. Pedometer programs that show increased physical activity for very low cost, and school health education as an example. So when you sort of put that all together and again tie it into the workplace setting, we sort of come up with this kind of a message that says you can ask people to change behavior and increase physical activity or reduce physical inactivity out of their day, but it's very difficult to do if you have to do it by yourself and your environment doesn't support it. So to change that, lowering the slope, if you will, or lowering the hill that you're walking up, environmental, meaning physical and psychosocial environment changes through policy interventions as an example, particularly as we've heard about this morning, can be really useful. So I think the combination of these two is what we need. We need to not decide one or the other. It really is an issue of a both and kind of scenario. Because at the end of the day, people still need to change their behavior as well. So then what does work to promote physical education at the workplace? So we have examples that relate to the notion of building physical activity into the work day. So looking at the job itself, the job flow, the workflow design, are there natural opportunities to build physical activity or motion in? Can you perhaps do booster breaks where you stop the assembly line for 5 minutes and everybody on that line at the same time participates in an activity to either do some flexing or some stretching or cardiovascular type of activity. The idea of instant recess came up this morning as well, which is a great example of something like that. Or walking meetings and making sure that people don't get interrupted, wearing of a lanyard that has little tag on it that says I'm in a walking meeting right now, so don't interrupt me. And so those are examples that actually can build physical activity into the workday. Other ways is to actually change the physical workplace. Here we think about things like how to use a staircase, or even finding the staircase in the building rather than using the elevator, or perhaps using little messages or notes, prompt, point of decision type of prompts that tell people to take a couple of floors using the staircase versus the elevator all the time. Sit-stand devices, which are, I think, have gotten a lot of visibility lately, and the idea that while you're doing sedentary work, you can break it up with periodically standing up and get out of that complete sedentary context. Activity-friendly campus, the idea of walking paths on campus, or even providing bikes to go from one building on site to another building. Incentives. We talked a little bit yesterday about disincentives as much as incentives, and depending how you use those, but the creative use of that clearly works. But then also starting to work on the culture of the organization. So changing the acceptable social norm, if you will, and do that through leadership. Leadership in particular here is important at the top level. You do need the CEO and the C-suite, so to speak, to be on board with these ideas, but you need more leadership than that. In the context of a corporate setting, you want that top leadership to set the vision for what's going on. But you want middle management, directors, managers, supervisors, to be engaged as leaders in order to get this idea fully into the organization across the board. And then you want frontline leaders to step up to get it deep into your organization. So it really ends up being a top-down and bottom-up kind of strategy at the same time. So you need multiple levels of leadership in order to do this well. Then the creative use of technology. Again, great introduction this morning on that topic, but wearable physical activity tracking devices, the pedometer, and then the pedometer with an app, and then the pedometer that automatically downloads. All of those things are very, I think, effectively used in the workplace setting. But otherwise, but in addition to that, online resources. Where do people go to track and see if their activity, for example, is linked to an incentive design? How do you know when you meet your incentive? How do you know where you are on that journey? You need access through a web portal. So now we're talking about not just a tool, but really a platform that ties all these different tactics together. So online, not just as a program, but really as a platform, if you will. Then the promotion of active commuting. Also another example that has come up in this workshop before. But bicycle to work programs are a really good example. Organizations that do this well can get up to 50%, 60% of their entire employee pool to actually bike to work on most days of the year. But they don't do it through one tactic. They do as much as they can in order to facilitate that to happen. And that includes looking at tax benefits, looking at incentives, looking at financial support for people to buy equipment, and not just the bike, but the clothing as well. Becomes very important when you live in Minneapolis, for example. Public transportation, another one, active transport, clearly linked to this, supporting not just ride shares for employees, but also the use of public transportation in general. And then really at the end of the day, it is about building this culture that makes it okay to be active. It is interesting to see that in many cases there may be literally a formal message from the CEO or the leaders in the organization that it's okay to take a physical activity break. But at the level of the worker, when they do take that break, it's frowned upon. And just the frown alone can basically eliminate that entire program. It is the culture of the organization that doesn't allow it. So in order to change that, you need multiple of these tactics to happen at the same time. And it needs to take some time, or you need to give it some time for that to take hold. But really at the end of the day, the culture of the organization becomes a strong predictor of whether or not these programs are successful. So then when you look at the literature, you're starting to see quite a few gaps. We know that based on systematic reviews, pedometer programs can increase daily step counts. We know that active travel, the bike, walk to work, can increase daily physical activity for employees. We know that workplace coaching can increase daily activity. Yet at the same time, the identification of barriers becomes almost more important, because there are lots of opportunities to bring physical activity in or connect it to the lives of workers, but they can't get around the barrier that's in front of them. So some of the key ones are that the design of these programs really should be based on an ecological or a multi-level model. Those were actually, these observations are consistent with what was recommended in the National Physical Activity Plan in 2009. And really the takeaway message there, that while you want to focus perhaps on physical activity, it does need to fit in the overall comprehensive multi-component approach that a company uses to improve health and well-being. So these programs need to fit, if you will, with other things that are going on at the workplace. So one of the ways we looked at this issue was to start thinking about a framework and holding up this framework against what we knew about successful programs. So this particular framework is basically saying whatever you do and the activities or the tactics are really part of the cells of this grid, you need to first of all make sure that if you want to be active, that it's possible for people to be active. If you're confined to an assembly line and the only thing you do is move the widgets from one place to the next, you sit down, or you're in a small cube on a telephone all day long, then it may not be possible to be active unless you change something. You need to make it possible. You need to keep it simple. The more complex the solutions, the less likely it is that they're going to be successful. You need to make it socially rewarding. If I do something with people on my team, I may find that I'm going to do this again because I enjoy the social reward that it brings. Financially rewarding. Is there something in it for me? Now, knowing that workers who exercise on average make 6% higher wages than people who don't makes a difference. Is it personally relevant? If it doesn't apply to me, I won't participate. Is it organizationally relevant so that the business will actually continue to support this? And finally, is it connected to the community, particularly in the context of sustainability? And as workers go home, they're back into the community setting, their family setting, and the next day they bring that back to work. And then you organize the interventions according to multiple levels of influence, whether that's at the individual level, you ask the individual person, the worker, to change or do something. Is it based on a group level intervention? Is it based on what you want the organization to do, a policy, organizational policy change, or the environmental level, so outside of the organization, connected to the community? Then whatever you put into these cells as tactics, make sure that whatever you end up doing is supported with an exceptional customer experience. The experience actually is very much related and predicts whether or not people will continue to do this and come back, if you will, for more. That then overall starts to get to outcomes, whether these are health outcomes, productivity outcomes, or financial return on investment. So we actually applied this entire grid to the essential elements list for highly successful programs that comes out of NIOSH, the National Institute for Occupational Safety and Health. And we basically crosswalked this list against physical activity opportunities in the workplace. So that work has been done. So that then gets us to the final part of this presentation, and that is, if you want to do this, then what are the design principles that you need to keep in mind? Which basically, makes us look at what do we know about success. So you've got to go back to the best practices, and these are particularly difficult to find. We looked at 28 scientific and gray literature or industry reports, consensus statements that had something to do with an identification of a best practice. It generated 44 best practices, and these are things like organizational commitment to a healthy culture. It's pretty gray when you look at it, pretty high level. Adequate resourcing. If you don't have the funds to do something, you can't do it. Meaningful, relevant incentives. Wellness champion networks. All these are related to successful outcomes. But when you look at these 44 best practices, some are tactics, some are sort of more general approaches, some are really more strategies than tactics. So they're all over the place. So rather than putting 44 best practices in front of people and say, this is what you have to do, we reorganize them, if you will, into design principles. Leadership, relevance, partnership, comprehensiveness, implementation, engagement, communications, data-driven, and compliance. So leadership sets the vision. It assigns accountability. It ensures structural support and resources, engages leaders, and sets policy. Relevance, it addresses the needs and the interests that optimize participation. It's tied to long-term engagement. Partnership, you need to partner with internal stakeholders, but also with external ones, particularly if you have vendors providing a program at the workplace. Comprehensiveness, which is actually the definition that comes out of Healthy People 2010. Is there a health education component? Is there a supportive environment? Is there an integration with the company structure, linkage to other programs like EAPs and screenings? Implementation. Did you actually do the work to get this done? So is there a plan? Did you coordinate the plan? Is it fully executed? Engagement. Promotion of respect and things like trust in the company, co-ownership of the program, so workers feel like it's part of who they are and what they're interested in. Leveraging culture, use of incentives, and what have you. Communications, use of a formal communication strategy that is linked to goals and objectives, using multiple delivery channels. Data-driven, use of data not only for monitoring, but also for learning and changing. And then finally, compliance, making sure that you're still in compliance with the law. So as a quick case study, 1 minute, no, 30 seconds, okay. Here is an example from, this is IBM. This is a case study well documented in the National Physical Activity Plan book, Implementing Physical Activity Strategies, that was edited by Russ and David Buckner. We have 6 case examples in that book. I picked this one because it's, I think, a great example of the use of technology, for example. This is physical activity and fitness, really promoted as part of an overall program for employee well-being. IBM created an online physical activity resource that they called the Virtual Fitness Center, which really serves as an interactive behavior change tool using goal setting, activity logging, team-based campaigns, progress reports, feedback loops, all those things that you would expect from a good behavior change program. The results in year 1, 16,000 people participated, which is about 12.5% of the employee target pool. No incentives was linked to it. It was just roll it out and see what happens. Then in years 2 to 4, they started to use it more strategically and tied incentives to it as well, and really added to it a group component. And use went up to 80,000 people, 63% of the employee base, which I think is a remarkably successful program. But then when you look at the outcomes, among these users, physical activity-related risks went down by 52%. Health perceptions, life satisfaction, smoking, body weight, overall risk status, all of those indicators improved. Average annual healthcare costs among users increased in the 3 years of the program evaluation period by $291 per year. But for the non-users, it went up by $360 per year. So sort of this leveling off of the trend line. And then finally, significantly lower inpatient hospital cost, heart disease cost, and cost to treat diabetes among these users. So from a business perspective, these are pretty powerful results. So I would say, just concluding, the workplace is complex, it's dynamic, it's changing all the time. When you insert physical activity and movement promotion activities, they do enhance worker performance. They support overall business outcomes. It should be part, though, of an overall well-being strategy. And if you have an organizing framework and you apply those principles for best practice program designs, then not only are they available, but they actually do increase the chances that you get success at the end of the day. So thank you.